I'm going to talk, fortunately this is going to be, I think, a very good complement with what Mark and Tom have done. This is going to be more sort of evolving thoughts and refinements. I'm going to talk about the concept of a glass of water emptying. I'm going to talk to you about what I think about what's called micro-transitions, creating ovals, not triangles, re-envisioning facial shape. I'm going to use an identical twin to talk about some concepts of anterior chin, and I'm going to talk about light reflex and how we perceive aging through light, and then I'm going to talk about an evolution of fat grafting using a hair transplant model that I think will become clear. So a lot of supplements today. First of all, if we think about aging, I think it's basically a volumetric loss despite some slowdowns in metabolism and dominant. It's just baby fat going downward. And a lot of times when you ask women after they've passed 35 years of age when they thought they looked the best, they won't tell you 18, 20 because there's a lot of profound baby fat that's there that doesn't necessarily bother them at the time but can in retrospect when they go back, search through those old photographs and are trying to determine when they look the best. It oftentimes is 30, 32. So I look at this sort of a trajectory going from baby fat to hollowness, and I always say if you look at your mother and your grandmother, it's just this sort of ongoing evolution or devolution of volume. So the idea is, if I use a glass of water, because you know a lot of what we try to do is communicate with patients using a language, and hopefully this will provide you a metaphor, if you will, so that you can communicate with your patients if you're interested in volume restoration, which is the idea that we fill the glass of water, and we fill it to an ideal level, not overfilled, because I think after seeing like Priscilla Presley and all the people that have been just way overstuffed, that there's a concept that a little is good and a lot is even better, and obviously that's not the case. And if you can state that on the front end, the patients feel much more comfortable. So I use Restylane. How do I use Restylane? I use it besides as a preview on the front end for someone that doesn't get volume. I use it also on the back end. And how do I do that? Well, I don't believe in overfilling a patient. I think that once you've overfilled, you can't take it back. It's very hard, especially even as fat evolves over a period of 2 to 4 to 5 years, it can continue to grow a bit. So you always want to be very, very careful. So I don't overfill, and I look at the idea that I can top off the glass of water to where I want it to be at a year or 2 years with some Restylane. And the other thing too is as fat evolves, we're going to talk about that improvement that continues over a period of 1 to 2 years, and patients can't wait for that optimal result. And Restylane for me serves as a stenting. It allows me to buy time until the fat improves. You probably won't get that, what I mean, until just a few minutes from now. But the idea is that also, if they get to their ideal faster, I can always dissolve the Restylane out since it's reversible. I'm going to talk about the idea that fat is like cottage cheese. In other words, it's extremely soft, very pliable. It's a beautiful contouring device, but it's not great for necessarily filling folds and filling in little transition points on the face that are really hard to create complete filling in. So you keep stuffing and stuffing this envelope or stuffing this balloon, and you just keep pushing more volume and you don't fill these little nooks and crannies. So you got to use how thick the product is, how durable and thick the product is for use in different contexts. I'm going to talk about how I use Restylane in that case. The other idea is the concept of the buccal area, and I've refined this even since the talk that Mark heard last year, where in the past I was dividing the buccal zone into multiple subzones, because it's not just this huge confluent area. It's this, you start looking at it and you start to see. At first I was talking about a central buccal zone, and then a backfill zone, and then a medial buccal hollow, and all those areas are important. But if you look, there's really, if you just take 2 fingers like this and you look at their buccal zone, there's 2 little circular holes that occur. One is in the subzygomatic region and one is in the central buccal area. And those are 2 principal areas I like to fill. To me, it's a great transition point, because oftentimes if we ignore the buccal zone, create a beautiful malar area, there's too much of a stark transition point between the mid-face and the lower face. And for the whole idea is unifying the face. And so the buccal zone serves as a very important landmark to transition from the cheek down into the lower face. Now, when do you do it? Well, first, when do you not do it? This is my own mom at 70. I did a transconj bleph and full face fat transfer. This is almost 2 years out, about 2 months short of 2 years. She's now 2 years out. And she's got a very full buccal area, so I didn't put anything there, and I want to actually offset it. If you look at this, there's a very strong cheekbone and a very strong malar eminence, and so what I want to do is fill around it, fill into the buccal zone, fill into the frontal zone, fill into the pre-jowl, into the chin, and this is a lady that's already had a facelift and brow lift on the left, and I think it creates better blending of the cheek region. This is a lady here that's a very subtle buccal transition point, mainly cheek, mainly anterior chin. She did have a plasma skin resurfacing and a very conservative upper bleph, and you can see that it's blended in light. This is so important, is how do you read someone? And what is important is to not look like Nick Nolte after a bad night. And unfortunately, most of our lives are lived with what? With overhead light. And if you think about the context, whether we're indoors or we're outdoors, there's almost always a top-down situation. I always say, except for Neiman Marcus dressing chambers in a cloudy day. So the concept is, you know, when I take my pre and post photographs, they're not taken in a room with flash, but they're also not taken in a room with this very, you know, Nick Nolte looking thing. It's a very small room with very even embankments of light, so you can actually show your volume changes that occur. So you want to replicate reality as if you're taking it from just looking at the person. And that's why if you look at it from a balloon model and there's deflation there, the more pulling back over bony, the tighter it gets, it doesn't matter. You're creating and accentuating transition points. The whole point is to diminish transition points, and that's through reinflating transitions and what we talked about, micro transitions, and just using this model of understanding top-down lighting. Why does fat get better over time? What? I thought it goes away. It does get better. And it also can get worse if you're putting too much in. So the question is, should you go back and do a touch-up every 3 months? And I'm going to argue no. I think of it through this concept of a graft. I think all of us can relate to the concept of a graft. If a graft has blood supply, why should it disappear at 2 years? It's ridiculous. So why would fat grafting at 2 years magically get up and walk out? It's like a skin graft dying at 2 years. Unless something compromises it, your graft is viable. It's just those first few weeks to months. So the idea here is what happens? So I was looking at Walter Unger's book on hair transplant. I started to think about how a micrograft works. And if you think about it, a hair graft is a micrograft. A fat graft is a micrograft done well. And so you get an early phase, which is called primary and secondary inosculation, where the blood supply is a bit tenuous and the graft is there. But neovascularization takes a full 6 months to begin to plug in. And when the plug-in is there, the fat graft actually continues to improve over 6 to 18 months. Well, that's exactly what I see with my hair transplant patients. At 3 months, I get some remarkable growths in a few patients, but generally speaking, not much. And I start to see from about 6 months to 18 months, great growth. Some people take a year to grow. Some people take 9 months to start that effect. Some people are, generally speaking, at 6 months, starting to show that improvement. So this is how I see things. Unlike hair, which is basically nothing, and then it goes up, the edema and some of the fat fullness that's there looks like a result. And then some people go through this dip. And if you don't warn the patients at 3 months that they're going to go through either a profound dip or a very minimal dip, then you're going to either be tempted to do a touch-up or you get an upset patient at 3 months, both of which I think could be potentially dangerous. So what I look at is the fat result actually matures over about 2 to 3 years. And there's a little bit of tapering, with most of the results occurring in the first 6 to 12 months and then a plateauing that occurs over the next year. I'm going to use some photographs to demonstrate. This is a lady that on the left has already had a facelift and some skin treatments, but obviously not to her satisfaction. She's about 48. This is 1 week out with fat grafting. If you guys don't know about managing bruising with IPL or laser, I learned it from my fellowship director, Ed Williams. It's amazing. It just blows out the bruise in less than 24 hours. This is she in about a month. And if you look at her, she's a bit cheeky, but it's not bad. She looks much younger. And as we go forward with this at 3 months, there's not much of a dip here. It's not bad, okay? So this is a great example of someone that doesn't dip significantly. But there's still a little variability in the result. If you look at 6 months, this is all consistent lighting, same room. This is maybe a slight dip. And then at 11 months, you can actually see maybe there's a slight improvement. And then about 15 months out, where I think most of my results start to plateau, you can start seeing that improvement. Now, imagine if I had touched her up at 6 months. Where would she be here? Way overcorrected. And that's why you want to think of this as a 5-year odyssey and not as a 6-month odyssey. And it's really very important to give that time for the patient's changes occur, especially if there's a weight issue. And I think that's a profound risk that you need to know. Remember, the fat grafting complications you get are not the ones that go away, or the ones that stay. This is a lady at 40 years old at 1 week, slightly bruised, slightly full. And at about, she didn't come in a month, but I usually see my patients at that interval. This is 3 months, and this is a profound dip. This is so much that I would say that the result is almost comparable to the preoperative one. And then about a year later, when I saw her, she doesn't live close by. And yes, there's a little bit, you know, not so perfect in the tear trough zones or wherever it may be, but you can see that there's a profound improvement in the skin and the volume and everything that's going on with those. And you can also see, just to let you know, you can see this is, again, the idea of a buccal transition point from a triangle to an oval, which I think is important. But again, there's an improvement. This is a gentleman at 1 week, slightly bruised, slightly swollen, and this is at 1 month, Looks pretty good, not bad. Pretty good for a gentleman. You want to keep your volumes relatively conservative on men. And this is about 3 months out, and it looks pretty close to the pre-op. Almost, it's like, 70% failure on this. And then as you proceed forward with this, at about 6 months, it's slightly better. And about 9 months out, it's gotten a little bit better. And at about a year, it's gotten a little bit better. And you can see there's a little bit of change. And sometimes, if you do hair restoration work, you'll see at a year, sometimes the hair dips and it comes back again. It's just interesting concepts with micrografts. The idea, I think that this, we've gotten 3 different ideas and concepts that are really good. And hopefully that this was helpful for you to get both a basic concept of fat and maybe some advanced ideas as well as safety.